Thank you to the people who are here with us. Definitely, thank you for making the time. And I will present our panel just really quick, and you will be getting to know them while they speak. So I will start with Fernanda Cobo, who's professor at the Ibero School in Mexico. Leila, senior consultant at Deloitte. She will be helping us with the questions that you guys will be sharing with us in the chat. Karla Macías, who's Director of Social Enterprise Development at Prosperia. Adalberto Méndez, who's partner in ESIJA. And finally, Basha, who's part of the worldwide public sector team in healthcare in Microsoft. And myself, I work as well in public sector in Microsoft, in healthcare and public safety and justice. So thank you all for being here. And I will start by saying that this panel was born with an initial thought that was that our reality with COVID is not going to be stopped anytime soon, sadly, but true. So some months ago, I was actually wondering if there would have been something that was done differently and where technology could have really helped us or more to avoid where we are now globally, or even more so in LATAM, which is part of what we're talking right now. With that said, I kept thinking, if there would be a real usage of data and AI to transform the information given to public institutions or governments to have better decisions for their citizens. I concluded something that probably no one would ever agree with me, but let me share my thought because it's really interesting, and we'll go from there to actually get our speakers into telling us what they think about my crazy thoughts. But what I was thinking is that back in the beginning of COVID-19, we recollected a lot of data of the disease, and we pretty much understood how to create the cure or even the vaccine faster than ever. We never seen any process of doing medicine so fast than what we've seen in the past years. But what we needed was to supply the vaccines around the world when it was actually done. So then we started with other problems. How do we distribute the vaccines? Were they given by truly analyzing the population's needs? Were they actually thought to help economies in our countries? Were they really thought to avoid hospitals to be super full? And we've seen that a lot in LATAM, even more in LATAM, but everywhere around the world. So definitely an important matter for us. How are those decisions really made? Are we lifting our communities at the same time, or are we just choosing who we want to help first? Then some thoughts actually came, and I was like, is there a way that we could have vaccinated first the young people, maybe people who pay taxes? I know these are crazy thoughts, but it's a way of actually understanding how decisions were made. Did we actually get the information that we needed to understand that we were acting fast? Were we acting intelligent? What if we would have vaccinated some other people instead of old people around the world? Economies in LATAM have dropped their investments 35%, taking us back 15 years. And this wasn't said by me. This was said by the Foreign District Investment in Latin America and the Caribbean in 2021. So what if data and AI would have better helped us understand the potential or beneficial cases or solutions towards helping more economies instead of saving lives? What if, or is it even valid in terms of looking to a closer future where other citizens would have been suffering less in the near future if we would have vaccinated other people instead of old people like we did around the world? Is the usage of data and AI truly being leveraged in our region? Are we just trying to replicate what other countries did before us? Who's crunching all the data? Are governments really understanding the data that's being crunched around? And Karla will help us with this a bit more in just a few seconds. But who's really taking the intelligent decisions? Or are there even intelligent decisions being made around the world? So Karla, just to go into what you really do at Prosperia and how you could help us understand this, my first and initial question would be, from data and analytics perspective and experience, because you have a lot in that, in which way has technology and the usage of data and AI really helped governments to address socioeconomic crisis of COVID-19? Like, are we really doing things right? Or is there something else that we could have ever done in the previous years?
Thank you, Anna. Thank you for inviting me to participate in this panel. I look forward to listening to my co-presenters, and thanks everyone who is attending this presentation. Let me share my screen to start and answer your question. Can you see it?
Yes.
Yes? Okay. Well, COVID-19 has brought an unprecedented challenges regarding the responsiveness of governments. No, the pandemic has exacerbated the difficulties for the most vulnerable people worldwide, thus demanding effective and timely responses. For instance, due to the socioeconomic impact of the sanitary measures undertaken, virtually all countries worldwide implemented social protection packages. Here are just a couple of examples of cash transfer programs in Latin America. And in order to implement them, suddenly policymakers were required to answer questions such as how many people will be pushed from poverty to extreme poverty, how to identify and target those most affected economically by COVID-19, such as informal workers, small and mid-sized enterprises, and women domestic workers, and of course, how to allocate limited budgets. At Prosperia, in collaboration with the Inter-American Development Bank, we have been supporting governments to improve the way social policies are delivered through data-driven solutions that enable policies to be more accurate, efficient, equitable, and transparent. One of these solutions is RIIAA, an interactive decision support system that empowers policymakers to simulate, evaluate, and decide between a large variety of potential designs and targeting schemes. On the next slide, you will see a video of how this interface looks. And in RIIAA, you can define eligibility criteria, geographic focalization, the amount of financial support for each individual or household. You can analyze the pre-policy and post-policy impact on poverty rates and inequality metrics, the cost of these policies to the government, and you can also visualize poverty rates, poverty gaps, segmentations by vulnerable subgroups such as country regions, female male-led households, formal and informal workers, type of households, etc. And the platform does it by processing millions of records in just a couple of seconds. In fact, RIIAA has been used for supporting the design of nationwide social protection responses in 8 countries in Latin America, and it is used by more than 15 institutions. Let me tell you about Costa Rica, one of our successful cases. In Costa Rica, the government implemented Bono Proteger to mitigate the socioeconomic impact of COVID. They use criteria to assess and evaluate this social program and concluded that it had an impact of decreasing poverty by 3.4%. They use the platform periodically to continue to assess the effect of the policy and to publish the results. An out is being used to think ahead on transition policies from emergency to new normality. And another of our cases is Honduras, where the platform was used successfully, not only in the context of COVID, but also with hurricanes Eta and Iota. And the platform assisted the government to allocate resources to those people that were most affected by using geographical focalization. So in conclusion, I can say that social policies are the main mechanism that we have for advancing social development goals, and the failure to implement them effectively can severely hinder society's ability and desire to reach shared prosperity. The COVID-19 brought an opportunity to improve the delivery of public policies informed by data analysis. RIIAA just an example of that. And we are also involved in other innovations like geospatial intelligence and data quality analysis system. So we really believe that data-driven decision-making will continue to be used not only to address future crises, but on a daily basis for the social protection sector. That's it. Thank you.
Thank you, Karla. Definitely, I agree with you, and we need more usage of technology, not only data and AI. Definitely, it's our subject now, but definitely we need more technology, whatever that means, to save our planet in terms of healthcare. And we need to understand that healthcare has been like the lost child of industries going into technology. Like we've just forgotten about it, and we have got an opportunity now to use technology to change where we are, and definitely not a good scenario to have COVID to change, but definitely until we really feel uncomfortable, then we choose to grow. But until we feel the pain, we're ready to change. And that's the real reason why we need to change. So definitely agree that creating this data will then lead us to really leveraging the information that we're creating and to change where we are. After this, and what you mentioned, and I agree definitely, like I was saying, I would ask Fernanda Cobo to understand from the public or government perspective, in terms of policies, where would we have helped LATAM governments use all the data and analytics that you were, for example, Karla, recollecting with AI and all the information that we have? Like, where do we get the package of information, give it to people who are really creating policies or healthcare policies? How do we engage there? How do we make things work? Or are we lost and the systems are not connected?
Thank you, Anna. Thank you so much for the invitation and for all of you to be here with us in this afternoon. So just to answer your question, I would first try to make a disclaimer, because you were saying things that I was not quite compliant with at the beginning of this table. Because you were trying to present us a conflict between human rights and economy that, from my perspective, it doesn't exist. The conflict between human rights and the economies is not a sum-zero game. Instead, it should be seen as a cooperative game, because economies gain if human rights are respected. And also, the vaccination segmentation policies were trying to be designed to lessen the death toll of the pandemic. And these decisions were also taken in accordance with what Karla was mentioning just a few moments ago. These decisions were taken with data. It was a data decision-making process, because older people and older populations have more risk of dying because of their health conditions and comorbidities than younger patients. This thing has been changing with the new variants and everything, but just for telling you this, because the WHO actually took this decision with data. And now, to answer your question, I think that countries, governments, and in terms of public policies, should have adaptive public policies and regulations for healthcare emergencies that enables us to use certain data in emergency settings. In this way, we could have had more data in the COVID-19 crisis and actually use them to produce more timely, focused, and adequate responses to focus also the government's scarce resources. Artificial intelligence raises a lot of problems in human rights that I will not make a point on that. But I will say that since the beginning of the pandemic, and in Mexico and in some LATAM countries, we've seen not only civil society and the government, but also enterprises trying to help the government with all their technological infrastructure to analyze and try to make these projections to focus the government's scarce resources. And what we've seen for example, in my case, when I was working at a national NGO trying to make these links between the industry and the Mexican healthcare system, was that, for example, we couldn't use mobile phone data because national regulations impeded their use. some months later, the government tried or obliged companies to provide them with this data, but we lost crucial time in the pandemic's control. We couldn't provide good and accurate predictions based on data recovered from different sources like gadgets, smartphones, smartwatches, because in Mexico, for example, we do not have a really good regulation. Even though smartwatches don't have some characteristics enabled, because the Mexican regulatory agency, in this case COFEPRIS, hasn't authorized them as medical devices. So that's also a big problem to have really good data. Also, we couldn't predict the impact of the pandemic due to lots of data, but data which was not information, and also data that was scattered all around the system, because in Mexico and in some Latin countries, we have fragmented health systems. That means that we have, for example, in Mexico, 6 different healthcare providers, which have 6 different, or we collect 6 different types of data in 6 different types of I've lost the word in English, but servers, now it came again, in different types of servers and in different types of infrastructure that they don't necessarily communicate between them. And also some problems are the relatively low monetary allotments that government have for infrastructure and technology. In Mexico right now, we are trying to migrate from the private sector controlling our servers, for example, to free everything, free servers, free data, free with all the security problems that brings for data protection. And this will be my intervention, Anna. Thank you so much.
Thank you, Fernanda. Definitely a good point that we lost time when this was actually starting and we didn't actually know how to communicate with private companies and governments and data and creating information and policies, and it was just a mess. I mean, definitely pandemic mess that we didn't know how to how to address, but definitely great point there. I will take then this conversation to Adal to just understand from the private sector's perspective in terms of laws or human rights, how could companies have shared with governments information to accelerate data and analytics from the citizens to deal with COVID-19 in LATAM? According to what Fernanda was saying, it took us a lot of time. So how could we have changed that if we could go back in time and see if there's something else that we could have done there?
Thank you very much for the question, Anna. Before to answer the question, I really would like to make some previous considerations about this topic, because when we are talking about the business and human rights relationship, it is a complex relationship, specifically talking about laws. Because if we can turn back time, we should be aware about the regulation that we need to be that we need to have related with the impacts of business activities on human rights issues. This is not an easy task, and this is a complex issue, considering that now there is a huge discussion, and the discussion started being accelerated after COVID-19. And now we are really close from a binding treaty on human rights that has been discussed in United Nations since 2014. That when the new relationships between business and states will change, considering new responsibilities related with human rights issues. So considering this, and considering that we've been discussing this treaty for almost 7 years, if we can turn back time, I think that one of the main tasks that we need to talk about is the need of states to regulate the relationship between business and human rights. That's why some of the issues cannot be really flexible when you are talking about data. I think there are some interesting examples of effective legislations that are really new. For example, in the case of France, where they start regulating this relationship since 2017, Canada in 2018, and Germany this year. And the European Union, they are discussing a European directive related with the impacts on business activities on human rights. Even in Mexico, we've been, right now it's being discussed, a law project on the Mexican Senate related with this relationship between business and human rights. And I know it because we've been the leading advisors of that law project in my law firm. So we've been really active on this issue. So I think that the first issue is that when we are talking about how to accelerate this relationship, for example, to attend COVID-19 issues on the business and human rights relationship, we need to start thinking about the international regulations that already exist since 1970. That is something that people maybe doesn't know at the beginning. But for example, we have the United Nations Business and Human Rights Principles that are really interesting guidelines related with this relationship that we need to talk about. Or for example, when we are talking about artificial intelligence, we have the Toronto Declaration related with the project, with the issue to protect the rights of equality and non-discrimination on the machine learning systems. Or, for example, if we are talking about data to use on COVID-19, this is a risky issue because you have a lot of information that you need to protect. We need to discuss about, for example, the Budapest Convention on cybercrimes. I think that there are a lot of international treaties and regulations that could be helpful, at least, to start thinking on an effective regulation who can make a flexible mechanism to provide the information that the technology companies have to attend this crisis in the case of COVID-19. But for example, I think that the main issue that we need to discuss when we are talking about this problem is in the case of the companies will be sharing this information to governments for an effective action on huge emergencies like this one of COVID-19. The main question that we need to discuss about is who will be accountable if exists a human rights violation or if exists a human rights breach on this sharing when companies are sharing information to the states. So I think that that's why we need to talk about that governments needs to provide effective provisions for citizens about their human rights and about the information that are being treated by the technology companies. And of course, companies, they will need to develop human rights due diligence mechanisms to assure to the citizenship and to assure to the state that they are providing some measures to take care of the information, specifically talking about on human rights context. That's why we need to start talking about something that is really different from corporate law, and that corporate law is not used to talk, that it's a human rights corporate due diligence mechanisms inside of the new companies. That now it's been regulated in the legislations like the French legislation or the German legislation, but it's not in all the countries. I will share just quickly an image just to share with you how this mechanism, it's a good practice that, for example, companies could start thinking about when they are talking about human rights risks, specifically on issues related with data. And I don't know if you can see the image on your screen, but this is. Yes. This is why what we said that companies will start thinking about when they are talking about compliance systems. That it's something that we call human rights compliance assessment, and it's an international system and specifically system inside of the companies that it will be ruled by international principles, but specifically guided by strategic issues, a risk analysis on opportunities related with human rights, policies, practice, and procedures related with human rights protection, and an obligation to monitor measuring impact on these issues, and of course having an impact of these measures inside and outside of the company. Just to finish, I would like to say that specifically talking about the new challenges that companies have on this issue, I think that we can have three specific conclusions. That business and human rights legislation needs to be made ASAP in all the countries because the information it's needed and we need to be really accessible on these issues. But we cannot given aside that the human rights discussion has been a hot topic specifically on technology issues. Specifically, we need to think about a strategic investment on human rights corporate advice for all the corporations to implement this kind of a specific and professional advice related with human rights impacts on the corporate activities. And the third thing is that we need to think about a new profile of professionals that has been involved on technological issues commercial issues or specifically business activities, but even more important, human rights impacts. That I think I have a bad news. There are not really a lot of huge or this kind of background is not really enough in the world right now to attend this kind of issues. So those are my considerations, and thank you very much.
Thank you, Alan. Definitely really interesting, and also, like with each one of you, I agree on a lot of things, but we need to keep changing, and we just can't go back. We need to go from where we are now, and just to really understand that we definitely need to change the not only the policies in the public part, but definitely in the private sector, all the things that we have in terms of privacy, and to really understand where we comply and where we can just keep helping, but without damaging anyone in the way. So definitely, yeah, really interesting, and thank you for that. Eric, this will be our let's say our final initial question. But I would like to understand from Microsoft perspective, as private global company and a huge company, definitely, how is Microsoft working towards facilitating the creation of information? A bit of what Adal was saying is just to really understand, if we're creating the information from data and analytics, how is this being leveraged by either private companies or either the public sector or just governments around the world to put a stop on COVID-19, at least now, and then maybe we could take some time to understand what has been done around the world, just as nice use cases that we've heard and seen around the world.
Yeah, no, well, that's thank you for the opportunity and the questions. And just by way of introduction, so my name is Eric Basha, and I am a colleague of Anna's in our worldwide public sector organization. I've worked for Microsoft for, it'll be 19 years next month, and the last 14 years in our public sector group. I'm currently focused on public health and social services. So Karla and Fernanda, your areas are very very close to the work that I'm focused on right now. And to answer Anna's question, and I think it's slightly reframing. We, Microsoft and even our large global competitors like Amazon and Google and others, we don't create the data that you're working with. We create, Microsoft in particular, we create those technology tools, and we're a partner-based organization, meaning we work with other technology companies that use our foundational cloud, artificial intelligence, and business applications technologies as building blocks as they create specific solutions that are focused on public health or social services or healthcare. So for example, we don't make electronic medical record systems, but companies like Epic and Cerner and Allscripts make those systems, and they use a lot of our cloud and artificial intelligence technologies. So we really do aspire to be a partner to the public sector, and we work very closely with our commercial partners. And I'm going to stop my video. If can you guys still hear me?
Yes.
Yes.
Okay. I'm attempting to share my desktop, but it looks like my screen is frozen here, so.
Ya no está.
And he's gone. He will be back soon, probably, hopefully. But yeah, I will, at least I will keep saying that as Microsoft, we have been working in public sector in different ways to help our governments around the world. Definitely trying to help LATAM as part of at least my priority or my region, in ways to not only understand how they could work with companies like Karla's and collaborate with others to just really create the information that governments need to then accelerate either the policies that they will be creating, but also to just really help them to transform a little bit the healthcare systems that we have. It will not be the answer forever to just keep waiting for other countries to create vaccines. We need to change that. We need to be LATAM. We need to create LATAM as a stronger region to create more things that will be helpful for us. So I know we're a great region, but we're just left behind, and this being left behind has been because we're stuck in ancient history in terms of just technology, and we keep working on-prem and doing things that were done a zillion years ago, and we need to change that. We need to change the policies. We need to change how we're working, and COVID has like pushed us to really change and start thinking different. And then we need to create the funds. We need to create the funding, the moving around the money to change. And like I was saying before, we need to understand that things can't go back to where we were. We need to keep going forward, and we need to keep helping us as a region, keep helping us as countries, but definitely things need to start moving more so forward than when we were at the beginning of COVID, because now we are stuck in terms of economy. We're stuck in terms of having still a lot of people sick. We're stuck having our hospitals super full. We're stuck everywhere we look around, and we really need just to change. We can't be on lockdown forever, and that's the truth. Our economies will not go anywhere if we keep locking down. And I know it has been helpful for some countries, but definitely, I at least that's my perspective. It will not be helpful for LATAM if we keep doing lockdowns, because we need to move our economies, and we just can't wait for magic to happen and people stop being sick. So I see Eric is now back. So Eric, if you're able to ask me for, I think it's like control or something. Okay, so he's logging in again. So let's just wait a couple of more minutes. And I will also say that we need to remember that no one will be safe until we're all safe. And we need to get vaccinated. We need to respect social or physical distancing. We need to start using the information that we're creating. We need to keep using data and AI to help us make faster and more intelligent decisions. Like I was saying, lockdowns might be a solution for now, but they will not be forever. We need to find other ways to control how the virus is spreading. And this might be something that keeps happening around the world. Like I was saying, lockdowns might have been the answer for some countries, but I don't think it will be, at least for LATAM. And we need to understand that strong primary health systems in the world, but even more so in LATAM, are something that we need to take care of. Countries are super left behind, like I was saying. We need to really take a look back and understand what was happening at the beginning of COVID, why things moved so fast and we just can't get over it. And we need to understand how to change, how to grow, and not repeat what we're doing. It's just the way we need to go. I will take some time, definitely, Karla, if there's something that you see from what we've said, from what Fernanda and Adalberto have told us, that you might say, maybe I could have done something different, at least on my perspective or on my work on my day-to-day, if there's something there that might have changed your perspective of how things are being treated in terms of the usage of data and AI and COVID.
Well, I think that in terms of for example, data protection and data privacy, we took the measures that we have, like, to do it, like, first of all, like, to work with publicly available data. And in the case of administrative data, all our information was anonymized. And also we signed like confidential agreements with governments. So that was like an important part, like in order to protect, because we deal with very sensible information. that in terms of data privacy and data protection, and in terms that in our engagement with governments, I think that we were able to respond like timely. That was because governments wanted to do it. There was really a desire to do the things, and also the data that were available were very useful. We work with governments that already have very, very good social registries that allows us like to work very, very, very fastly.
Thank you, Karla. Definitely good point there. But I think, yeah, I don't know. In terms of time, I'm always less happy on saying that we acted fast. I always think that we're super slow. I don't even know why, but I mean, I've never lived a pandemic before, so I don't know how things are fast or slow. But I just feel that we're slow in terms of acting. Not you or your company, but definitely as humans, we were just super slow in understanding what was happening. And I know researchers were super fast in accelerating the vaccine, but the rest of the world, we were just like, should I use a mask? Should I do social distancing? Like, I feel like we were just going 2 steps ahead and 1 forward. And I don't know, I just feel like things were weird, and hopefully this will help so that in the coming years we don't live this way again. Oh, Eric, you're back. Welcome. You're muted, so we were missing that comment, so yeah, thank you. Still muted, Eric. Nope, not working. Still muted, Eric. I wish I could unmute you, but I don't think I can. Is that helpful? No. Okay. I guess he'll be back soon. Fernanda, do you feel that some of the comments, some of the things that even Adalberto was saying that could actually comply with the policies, some of this was something that might have come to your mind differently from what we were saying before?
Yes, I really think that the Mexican government, for instance, didn't act as quick as it should have. Firstly, because since the day one the first case was diagnosed till the first regulatory action that was taken, it took more than 2 months. 2 months in which we could have planned everything, since purchasing personal protective equipment, till purchasing some kind of different diagnosis or tests, or implementing just the WHO COVID-19 responsive policy framework, which was produced and also made known by the WHO in December 2019. So I am telling you that the Mexican government was more than 5 to 6 months late in its response. So from my perspective, the public policies issued to face the pandemic were really late. So that's something that I comply with you, Anna. And also to tell you that LATAM health systems were already really hindered when the pandemic came. We didn't have really good healthcare systems in LATAM. The Mexican health system had undergone severe changes to its legal structure in November and December 2019. So when the pandemic came, the Mexican health system was transitioning into some kind of a strange universal healthcare system, which we couldn't have still managed to create. So when the pandemic came, we were in this like crazy administrative revolution in Mexico, and I really think that this was one of the main causes why our response to the pandemic was really late. And also our lack of usage of effective technology. And you and I, we lived it. We lived the transition from private services to open source services, and what that made in the healthcare system. So just for you to know, in the Mexican Institute of Social Security, the 90% of the computers run in Windows 95. So just to give you an idea of the big technological problems that we have at all levels of the healthcare system in Mexico.
Thank you, Fernanda. I would just add on top of that to say that if you have a computer, it runs in Windows 95, but definitely sad part there. And when we think about LATAM, sometimes it's being thought that Mexico is one of the biggest or more technological countries from the region. And when we hear this, it just breaks my heart, because we're like I was saying, we're just so old. We're not looking towards changing, and we're just living day to day, trying to find our ways. And we need to find more people creating information, like Karla was saying, just to develop really information from data, and really just changing how we think and how we move forward with policies. Adal, before I go to Eric, is there something that you think from what we were saying before, and maybe from that public and the data and AI information, is there something that might have changed by hearing the rest of our colleagues here?
No, I just would like to say, like, in the case of the Mexican government, I don't really believe that exactly they had tons of opportunities to make the things in a good way, and they are not doing it. And specifically talking about what we were discussing about, what I think that it's important to address, that is the business and human rights relationship. Since 2014, in the former government period, they start a process with Mexican NGOs, academia, and some companies to start a strategic national plan on business and human rights. We are in 2021, and the plan still stopped. They have not interest to discuss this issue. The law project related with the business and human rights relationship has been 1 year without any kind of discussion. So at the end of the day, I think that most of the huge challenges that we have, specifically talking about COVID-19, maybe are related with the political will. And when the political will is not concerned about the human rights needs and the health issues that we need to address, but specifically the strategic investment, for example, in technology, on free internet for all the vulnerable groups that they need to be internet connection or something like that, the political will could be really, really a huge, could be damaging the social needs. And I think that that's the main important issue that we need to address, that if we are going to face new challenges after COVID-19, maybe it's time to take these crisis problems, these critical problems, to the tribunals, because maybe we will find a new opportunity to make mandatory these kind of obligations for the government facing the new challenges related with COVID-19.
Totally. So yeah, thank you for that, Adal. Definitely nice thought there, and things that we need to take to our governments and ask for and demand as citizens, because we need to change how we're working now, because it's clear it hasn't been working. So yeah, agree on that. Eric, I guess if you're not muted now, we could definitely listen to your part.
Can you hear me now? Okay, all right,
yeah,
good.
You're good to go.
Good. All right, let me try to share my desktop. Can you guys see this slide?
I guess it's on the way, so let's just give it a sec.
Okay, let's see if that works. Let me know if you can see this.
Yeah, it works now.
Okay, and so I just to pick up on a few of the comments. As I was saying before I had technical issues, technology companies, certainly Microsoft, we aspire to be a partner of public sector to really enable our health and social services and public health customers, most of whom are in the public sector, work together collaboratively with the private or commercial sector to serve citizens in a fair and equitable way. And so, the things like data silos and archaic equipment and not being really ready to meet the challenge of a global pandemic, that obviously is not unique to Mexico or Latin America. Certainly the United States and virtually every other country in the world was caught flat-footed and ill-prepared to battle this once in a century global health issue that none of us in our generations or prior for the last 100 years have seen anything like this since the 1918 flu pandemic. So I listed about a half a dozen areas where artificial intelligence in particular is helping monitor and surveil disease. I mean, certainly COVID-19. Before COVID, it was infectious diseases like Zika or Ebola. In the United States, we had an outbreak of what was called vaping-related illness, and that 2 years ago was very much the hot topic of public health, trying to figure out why people were having lung damage due to e-cigarettes and other vaping. There are a lot of great use. If you've seen the Johns Hopkins or some of the other global health maps of not just tracking COVID infections, but doing forecasting and predictions in terms of where that's going to be. A lot of that is done by our partner, our Geospatial Information Services partner, Esri, that uses our Azure service and to present that. And I'll share this slide, and the link has a link to the Johns Hopkins website and others that are well known for that kind of disease tracking and surveillance. We talked about the topic of vaccinations and who gets vaccinated first, and how vaccines are allocated and people registering and the whole administration. Along with this goes vaccination verification. So if you're traveling or you're going to a sporting event in some countries, you need to show proof of vaccine. All of that is facilitated by technology, and especially artificial intelligence, as it looks at matching vaccination sites with the populations most at need, or perhaps where to locate a vaccination location based on infection rates, based on maybe access to other healthcare or other perhaps private or commercial sector health providers. So where can public health step in and fill the gaps? Fernanda mentioned the 6 health systems in the U.S. It's probably 60,000 different disparate private health systems at the height of the pandemic. And actually, unfortunately, right now we're having a resurgence with the Delta variant, and many state public health entities are creating an overarching kind of Uber view across multiple private hospital healthcare networks to look at bed availability in intensive care units and look at where scarce resources like personal protective equipment or ventilators or intubators, along with vaccines. How can they ensure that they're doing the best job of distributing those essential medical supplies and resources to the point of care, and also ensuring, like with hospital beds, how are they directing citizens and patients to go where there is availability? Because right now, I live in Washington State, in a rural part of Washington State, and currently many of our hospitals are full with COVID-19 unvaccinated people. And the reason these people, my fellow citizens, are unvaccinated currently where I live in northeastern Washington State has nothing to do with vaccine supply. There's plenty of supply, but there is a lot of vaccine hesitancy, and there's a political aspect. And so the second from the bottom, the public health communication and education, understanding what people are saying in social media and the role that artificial intelligence and cognitive services can have in social media analysis or sentiment analysis that helps public sector or public health organizations formulate their communication strategy and combat false or misleading information. can be a huge help. And we have a partner, Zen City, that is using our Azure Cognitive Services to understand the underlying concerns and reservations, and helping public health entities form a communications plan that addresses some of those concerns and helps educate people to the facts. Which, as we all know, this is not an issue that is unique and specific to the United States. There's a great deal of politicalization and misinformation all over the world about both the virus and the vaccines. So having that communication education plan is super helpful. Last, I just wanted to touch on the use of bots and virtual assistants. They've been super helpful in terms of disseminating information and helping people get their questions answered. Those could be questions about, in the early days, about how is COVID spread? What can I do to help protect myself and my family? Where do I go to get tested? What are symptoms? Those kinds of things that, typically that has taken a person answering a phone or answering questions online or even answering questions in person. The ability to use a bot that someone can access on their smartphone is a great way to unburden staff and allow the staff that is in short supply to go on to higher level service. And the same can be said too also on the social services front, because we saw unprecedented levels of unemployment claims and claims for other kinds of temporary assistance, whether that was food or shelter assistance, because so many people were pushed out of work because their businesses were shut down as part of the attempt to stem the spread of COVID. That had a massive burden on our social services infrastructure and ecosystem. And again, health bots and other ways to understand where the greatest need was and how you're shifting and allocating resources, all using the sort of data and intelligence, are all areas that were super important roles that technology is helping public health and social services and healthcare providers, again, address the pandemic, but doing so in an equitable and fair way, or at least attempting to. So anyway, I'll share that slide and we'd be happy to chat about any of those scenarios.
Thank you, Eric. We just have a couple more minutes. I don't want to take all the time, but I will definitely thank you again all for being here, for letting us just talk about this and going all the way around to really understanding not whether, but when we have some trouble like a pandemic, which is something, like you were saying, Eric, that hasn't happened in a lot of years, 100 years or so. When things happen, when things come to this point, we really need to start understanding where we can start helping. And it goes from like the beginning of this conversation, where we get the data, how we analyze the data, how we create information, send it to the governments, create policies, get the help from private companies, and then start making or changing the laws that will help us really cooperate to create something that will work for our citizens. And then we go from the private sector and say, this is what I can do for you, other companies, or other ways of not just helping the governments, but to really just being able to help everyone around, because these are weird times and we need to be united. Like I was saying, no one will be safe until we are all safe. And until we understand that, nothing will change. So I'll just leave maybe one more minute. If anyone, Karla, Adalberto, Fernanda, Eric, or even Leila, if there are any comments that you wish to just share with our public here, and then I guess we'll be done. So I guess we're good. Thank you again for all.
I have two. Yeah, so I do think one would be, there was a reference earlier to open source software, and I do think it's important because semantics matter, really ensuring it's open standards, because even with open source software, you can have a closed ecosystem and you can have a proprietary system built on open source software. So we advocate very strongly open standards, and that creates a level playing field, whether you want to use commercial software, open software, or open source software. adhering to those open standards. And I think that's super important. And then, the other point I was going to say is that around, again, public-private partnerships, and also working with academia and trying to, everything from educate to have clarity of facts and data, empirical data, can be super helpful and informative in breaking down some of the myths and falsifications. My last point, and I promise that this is it, is that in sometimes countries that don't have a lot of investment in technology and haven't had, don't have legacy ecosystems of technology, big mainframe systems or existing health systems, are actually in a better position because they're not encumbered with these old systems with millions of dollars of investment. And modern cloud technologies, whether they're from Microsoft or any of the other cloud providers, can often be way more effective and certainly economical and agile, and ability to stand up at a fraction of the cost of those old systems. So I don't think that's necessarily such a liability not to have so much of an IT or technology sort of infrastructure that can be a benefit. So
thank you. That's definitely a good one. Fer.
I will just want to close these reflections, just telling you that yes, artificial intelligence raises a lot of issues. Issues like freedom of expression issues, privacy and surveillance, ownership of data, bias, discrimination, misinformation, trust, environmental impact, a lot of things. But I really do think that we as public health systems and public healthcare systems need, just like Eric was telling us, need just to incorporate whatever we can to try to advance in guaranteeing effectively the right to health of our population.
Totally agree. Adal or Karla, something else that we might want to add?
Well, I just would like to say that I think that when we are talking about data and the responsibility of corporations, specifically on human rights issues, compliance, it's a really powerful tool to prevent any kind of business risks. And I do really believe that the compliance culture is not only to be present in the private sector. We need to start thinking about of a public compliance even for the state organizations or the public entities. So I do really believe that compliance needs to evolve, needs to be a new kind of compliance with a strong and really profound human rights perspective, and that corporations has a huge challenge in front of them, but also states, specifically talking about regulations that demands an obligated compliance requirements, specifically when we are talking on potential human rights violations. And of course, I think that would be for sure now the upcoming challenges after COVID-19, how to protect human rights issues, specifically on the business commercial activities. I think that we are going to need to be discussing more and more, specifically considering that we are really close to have a new international binding treaty related with the human rights and business activities. And that's it. Thank you very much.
Thank you, Adal. I think we're done with our time, but Karla, I don't want to take any final thoughts away from you. So let's just listen if there's something else.
Just to take advantage of these advancements in technology that everybody did during the pandemic, that we have to take advantage of that and to continue to work.
Totally. Well, thank you all again. Thank you for the people who joined us to listen to what we had to say. And thanks for the collaboration here to all of you. So hope to talk to you soon. And if there's any questions from the people who join the sessions, you can definitely look us up probably in LinkedIn or something and ask anything if there's something else that we might have missed. So thank you all.